Welcome back. COVID-19 remains at top of mind for many parents throughout our state. So we're joined this morning by Dr. Joe McBride. He's the infectious disease pediatrician at UW Health Kids in Madison. Dr. McBride, thank you for joining us this morning.
Yeah, thanks so much for having me.
Of course. Well, we'll jump right in. The vaccination rates for younger kids are still very low compared to other age categories, and that's according to the state. But why the hesitancy with some parents?
I think the big reason is most people at this point know that COVID is more of a severe disease in our adult population than our pediatric population. And so I think that drives more motivation for an adult to be vaccinated than for parents to vaccinate their school-age children. With that said, though, we do see a lot of illness associated with pediatric COVID cases. And right now, COVID is one of the top 10 causes of morbidity and mortality in the United States for pediatric patients, too. So it is something that we do recommend school-age children to get.
Definitely. And with masks still required in some area schools, it can be confusing for parents to know what kind of mask is best. What should kids be wearing while in class, do you recommend?
Yeah. So the best mask for a child is one that they will wear. And I think all parents can realize this, that there are certain types of masks that maybe an adult could wear easily, but their child can't, based on them tugging at it or pushing it or, it's under their nose. So the first thing for parents to consider is a mask going to be worn by my child appropriately, covering the nose and the mouth? If they get one of those KN95 masks and the child is pulling at it, tugging at it, that is not an effective mask and they should not use it. And then go back to some of the other cloth or surgical masks. Masks are best used when both parties are wearing them. And what I mean by that is not only the individual themselves, but the people around them. And if those situations are occurring, then just a regular surgical mask could be okay. But if you're in a situation where you're the only individual that is masked, boy, I'd really want some additional security. And that's where some of those better, well-fitting masks like those KN95s or N95s would be recommended. But again, very hard for certainly young children to be able to tolerate those masks.
Of course, and we'll end it this morning with this question. Some parents are still unsure of what to do if their child does test positive for COVID. What can you tell us about that?
So for pediatric patients who test positive for COVID, there are not a lot of therapeutics outside of the hospital available to them. So adult populations have oral antivirals or have some monoclonal antibodies that could be available. But for peds patients, there really is not much that we can do. So that really goes a lot to the symptomatic care. So staying at home, lowering fever and temperature with things like Tylenol or Advil, chicken noodle soup, things like that to get your kid, through the initial illness. And then certainly if they're having problems breathing, looking ill, needing to seek medical care, well, then of course that they should seek out help from their local healthcare providers.
Well, wonderful advice this morning from Dr. Joe McBride. Thank you for joining us.